Hi, everyone. Thanks for tuning in and welcome to Living Teal Food Allergy Awareness Week. My name is Satya Shanmugham, Director of Program Management at FAIR, and I'm honored to be joined here by FAIR's Chief Research Strategy and Innovation Officer and Interim CEO, Dr. Bruce Roberts. Welcome, Bruce.
Thank you so much, Satya. It's a pleasure to be here and a pleasure to celebrate Food Allergy Awareness Week with you.
We're so happy to have you, Bruce. Why don't you tell us a little bit about how you got into food allergy research?
Well, thanks for that question. So my entry into food allergy research really started during my days working at Genzyme Corporation in the immune and inflammation department. And at that time, we were basically looking at various ways of controlling undesirable overreactions, immune reactions, whether it was in the area of autoimmune conditions or transplantation or food allergy. And we actually had a program at that time in which we were trying to figure out ways to reduce the overreaction to peanut allergens. And so it was a vaccination approach, which was very novel at the time. And then subsequently, I got involved with the program that Regeneron and Sanofi were moving forward with, which was the dupilumab program. And at the time, it was all about development for atopic dermatitis, but it was obviously a drug that had great potential for other applications. And subsequently, I was chief scientific officer at Vedanta Biosciences. And at that time, I came at it from a different angle, thinking about the role of the microbiome as it relates to food allergy. And so we actually did some key translational medicine work together with Dr. Carrie Nadeau, which gave us some nice insights in terms of how the microbiome might influence the development of food allergy. And that actually led to the development of a specialized probiotic that's actually being tested in the clinic right now. In conjunction with peanut oral immunotherapy. So it's been a bit of a journey, but probably 12 years in total, in various aspects related to thinking about how to control food allergy.
That sounds very exciting. And I'd like to get back to that microbiome piece. For those of you watching, please feel free to add your questions for Dr. Roberts in the chat box, and we'll be sure to get to them. So going back to the microbiome, it seems that it's a hot topic across many different fields of research. What do we know about the microbiome as it relates specifically to food allergy or atopic disease in general?
Yeah, it's a really good question. And I think we have to look at the fact that largely what we understand is in terms of the development of food allergies, so the role of the microbiome in infants. And so what we know about the role of the microbiome in adults or adolescents is actually not so clear. But one of the things that we did understand in a collaborative study, translational medicine study, is that it seems to be out of kilter in individuals who have food allergy. So just to take a step back, when we're talking about the microbiome, it's basically the assortment of microorganisms that live in our bodies. And more specifically, we're talking about those that are resident within our gut. And it's important that they reside there because they basically condition our immune systems. And so we acquire those organisms through diet, and they help us basically digest foods, but also they help maintain balance within our immune system. So what we've come to realize is that if there's a perturbation, and you can do that in a number of different ways. For instance, antibiotics have the capacity to perturb the composition of the microbiome in very meaningful ways. But if you perturb them, some of those beneficial bacteria that we need to basically condition the immune system can be obliterated, and it takes them a long while to come back. So if you have a paucity of those types of beneficial organisms, it can actually tip things in a situation in which when you encounter a food in the gut, you may actually find that rather than just reacting and tolerating it, you see it as foreign. You see it as something that shouldn't be there as a potential threat. And so that leads to an allergic reaction. So it's also important to recognize that there's different types of microbiomes. There's one that's in the skin, there's one in the nasal cavity, there's one in the oral cavity. There's a number of different microbiomes that exist all throughout the digestive tract, but we tend to focus much of our attention on what's going on within the gut. And what we do know is that during the first year of life, there's an unprecedented series of changes that occur in the composition of the microbiome as the child's diet changes. But as they get to a certain age, when they're getting past, they're in the weaning stage and starting to consume solid foods, they take on a much more diverse population of bacteria in the gut, which they need to basically maintain that balance. And if that doesn't exactly go according to plan, it can lead to this imbalance in a situation where instead of actually accepting foods, you may have an adverse reaction. So there's a lot still to be understood in this area, because it, as to your question, it's not only related to food allergies. We know that it also plays a role in the development of other atopic conditions.
Thank you, Bruce. That's a very helpful background on microbiome with food allergy. Let's talk about maybe why do people get food allergies? What kinds of other factors might contribute to someone developing food allergies?
It's really a complex story because, again, we tend to focus very much on what occurs during the first year of life. And in those circumstances, often we'll actually see that in children several months old, they have already developed peanut allergies. And then subsequently later on at 12 months of age, they manifest other types of food allergies that can occur. So what's happened? Well, we don't entirely know. We believe that it's actually a plethora of different factors that all work together in order to have the effect. So we just talked about the microbiome and the importance of having beneficial organisms within your gut that basically create for a more tolerant environment. Certainly genetics are going to have a role. So whether your parents basically have had a history of the development of certain atopic conditions, that could influence whether you're likely to have a food allergy. Certainly the events in terms of the exposure to food allergens are going to have an effect as well. And so that can have an influence. And so typically we imagine right now that under normal circumstances, the default situation is that as you encounter a new food in your diet, your immune system is basically programmed to try and accept it. You don't want to reject it. You want to be in a position to say that this is normal and this is something that you don't want to overreact to. There's something goes wrong during that process. And it may be, and certain hypotheses present, that if there's a breach somehow in the skin or the mucosal layer in the gut, that food protein actually gets in and comes in contact with your immune system in a way that ordinarily it shouldn't do. And under those circumstances, you would see it as something that's unusual or it's potentially a threat, and you mount an immune response to it. So that could actually set the stage so that now you are sensitized. It doesn't mean that you have an allergy, but now you will perceive that protein is potentially something that shouldn't be there. So the next time that you consume that food, might be the point in which you trigger a reaction to it. And that's sort of the classic responses that we see with allergic responses, which can be localized in the gut, or they can be systemic throughout the entire body and manifest themselves in that way. So it's probably multifactorial. There's a number of things that lead to it. And this is why we basically need to invest more time and effort to really understand those factors that contribute to the development of food allergy. Also, it's important to note here that food allergy can develop at all ages. So for instance, our patient registry is basically a database which enables us to understand the patient journey. And within it, we know that food allergies can develop early on in life or once people are adolescents, or actually there's a form called adult onset food allergy. And we know very little about why it is that individuals who presumably have tolerated certain foods all throughout their life suddenly become allergic later on. So there's a number of factors that are most likely leading to the development of food allergies. And we really need to understand more how that is occurring.
Thanks, Bruce. It sounds like it's a very complex and complicated set of causes that potentially could be working together. So a lot still needs to be done, to find out more. Well, you've addressed one of our questions from the audience regarding adult onset. That is kind of an interesting situation there. What about on the flip side? What about prevention? What do we know about potentially preventing food allergy?
It's a really good point. And so I think our best evidence in terms of how to prevent it is to basically capitalize on early dietary intervention. And what I mean by that is that one school of thought was once people have a food allergy, avoidance is the only way to deal with it. Stay away from it. So then a radical idea was actually introduced by investigators at King's College in the UK many years ago, in which they thought, wait a minute, what if you actually introduce that potentially allergenic food in the diet very, very early on before you've ever gotten food allergy? And that basically led to a very successful clinical study, which is called the LEAP study, that showed that in fact, early dietary intervention and inclusion of peanut in the diet prevented the development of food allergy in infants. And the trick was to actually get in as early as possible, so that in fact during that whole process where I've talked about that development phase where the microbiome is developing, that's when you want to intervene, is you want to introduce that food before things have gone down a different path. So that is probably the best evidence that we have. In fact, you can prevent food allergies by early dietary intervention. And in fact, there are guidelines specifically related to peanut. But there's no reason to believe that, in fact, that general concept isn't applicable to other foods. And so this is something that FAIR is actually championing in conjunction with investigators at Northwest University in terms of thinking about how do you include a multitude of different potentially food allergens within the diet in order to ensure that they're accepted later on in life. So that's certainly one way that I think is our best evidence in terms of how you can prevent it. But going back to our earlier conversation, there's other thoughts related to making sure that the microbiome is in the right configuration at the time that you're being introduced to these various foods. So it's a combinatorial effect. It's not just the food, it's the microbiome as well. So there's certainly investigators who are of the opinion that what you really want to do is make sure you top up the microbiome with the right composition of organisms during that first year of life in order to make sure that you create that accepting environment so that people will tolerate foods. So that's another idea. And so in fact, what you're starting to see is there's a multitude of different ideas related to how you can prevent food allergy. And that just points to the fact, in fact, we have lots of approaches, with lots of ideas that we believe would actually do it. So there's early dietary intervention, modification of the microbiome. There's also the idea that you could modulate the immune system by using immune modifiers to change things. And coming back to this idea that in fact, that perhaps what's happening is that your first exposure to that food allergen is through a source or site where it ordinarily shouldn't happen, like for instance, through the skin. And so if you have an individual who has potentially atopic dermatitis, then the skin is damaged. And so your first exposure to that allergen might be through the skin and not in the gut, which is the sort of the normal route of exposure. And that could lead to sensitization so that the next time you encounter that food, it actually sets off an alarm system in the gut. And the reason is that, in fact, your first encounter with that allergen was in an unusual way. It was actually a deviation from the normal way that you should encounter food through some sort of breach in the skin or in the intestinal tract. So that's setting the ideas for yet another approach, which is, can you actually repair either the skin or basically any sorts of breach that might be in the gut in order to create for basically a barrier between the outside world and ourselves, so that as we're consuming these food allergens, we're not likely to overreact to them. So it's a great question. And I think that the fact that there are a multitude of different ideas that are being explored to stop the development of food allergy tells you, that we have a number of concepts to follow up on.
It sounds like those concepts are very promising, and I'm excited to see, what comes out of these studies that are hoping to prevent food allergy development in young children, especially. One of our audience members has asked something about, growing out of allergies. Do we know anything about how someone might outgrow a food allergy?
It's an interesting point, because I think we have to be very careful in terms of the interpretation of what we see. But there is, I think, a history of spontaneous resolution, as we would call it, of a food allergy. And it tends to be more evident in some individuals than others. So for instance, often people will say, I used to have a food allergy to milk and I just grew out of it. And so the first thing you have to do is, well, did they actually have a food allergy in the first instance? Because it could have been something else. It could have been an intolerance or something else that occurred. So it was not actually a true food allergy, because in that regard, in order to have that confidence that somebody has a food allergy, ordinarily you need to undergo some sort of a diagnostic test. And so it's one thing that you might have a reaction to milk, but it's another to actually be tested and to have it confirmed. So there could be circumstances in which people's tolerance can change over time. But if you have a true food allergy, it is true that a subset of individuals may have resolution as they get older. And how that occurs, we don't know. They're obviously the lucky group that basically experience that kind of phenomena. And so it's more likely to happen with certain food allergies than others. So for instance, peanut allergy tends to be one of those that develops early on in life and stays for a very long period of time, even out into adulthood. So it's not often that you hear about cases where people spontaneously resolve their peanut allergy, but there are other forms of allergies which are more amenable to that kind of approach. And why that should be the case, why should people basically be in a situation where they are more likely to resolve it as opposed to others, we really don't know.
Sounds like there's a lot more research to be done in that area. Is FAIR, looking to support research in that space?
Very much so. So essentially, one thing that we need to do, and again, coming back to our patient registry, is we just need the data. We just need to figure out what's the frequency with which when individuals who have a bona fide food allergy resolve. And how did that occur? When did it occur? What were the events that actually led up to that? There's very little information that we have at our fingertips or in the literature that give us those insights to understand just how frequently does this occur and in what circumstances. If you are food allergic, often you are allergic to multiple foods, not just to a single food. So if one food allergy, like a milk allergy, goes away, does that mean the other ones go away at the same time, or you're still retain the other ones? We just need to have basically a lack of information related to these processes. So one thing would be, let's just get the basic facts related to how frequent it is and what are the circumstances. And then knowing what that patient population is, it could set the stage for biomarker studies or other kinds of observational studies in which we could monitor over time and look for those individuals who are fortunate to actually resolve a food allergy. And then we can ask some important questions about what was it? What happened? Was there a triggering event? Was there something that occurred? Or did their immune system somehow change during that period of time? So something that was perceived as being a threat is no longer a threat, and it just went away. So that's an important area of research, because it could lead clues to how we can actually capitalize on that and apply it in a directed fashion to other food allergies.
Thanks, Bruce. Out of curiosity, is someone maybe more likely to develop a food allergy if they might have another type of atopic disease like eczema or asthma?
Well, I think, again, we need to be careful in this area because we talk about the atopic march. And so many of these diseases like atopic dermatitis, asthma, food allergy, EOE, they fall into a family of related diseases. And the reason why they're related is that the immunological pathways that are involved are often very similar to themselves, but the manifestations are different. So you can fall into the fact that perhaps you get this situation where you perceive, well, I had asthma and now I have food allergy. So therefore, one lead to the other. Well, where's the evidence for that? I think where we actually have the most amount of evidence that relates it, that there's a connection, and it comes back to the idea of how do people develop food allergies, is we know that atopic dermatitis, also known as eczema, is a risk factor for the development of food allergies. And why would that be? Well, if the skin barrier is breached and you're likely to encounter peanut allergens or other food allergens, and your first encounter is going to be through the skin and not through the gut, you can see logically that that could lead to a situation where you might be primed, now be sensitized to that particular allergen. So we know that there's a correlation between atopic dermatitis and food allergy, but it's not a one-to-one correspondence. And that's, I think, the important thing that we need to recognize. Just because you have atopic dermatitis doesn't mean you have food allergy. Just because you have food allergy doesn't mean you have atopic dermatitis or asthma or one of these other conditions. So there's certainly at the root of these things some commonality in terms of the part of the immune system that's actually activated, but whether in fact they're directly linked to one another, we really need to have more data.
Thanks, Bruce. Let's talk about treatment on the flip side of this. Right now, other than, let's talk about oral immunotherapy. I think that's the big one that people have heard about. What exactly is oral immunotherapy, otherwise known as OIT, and does it have any limitations?
Yeah, great question. So the idea is actually very, very old. The idea is that you can induce tolerance to foreign proteins just by consumption. And the mechanism as to how that occurs is not really well understood. But essentially, the idea would be is if you can basically take that very food that you're allergic to and take minute quantities of it and then have an individual consume it safely at very, very low levels, then what you do is you incrementally increase the exposure to that over a period of months, so that you're increasing their ability to tolerate it. So you start at a low level, which can be tolerated. Once they're comfortable at that level, you step it up and you go to the next level. So you incrementally increase the quantity of the food allergen that individuals are exposed to desensitize them. And it can be done through a number of different routes. So the classic route is oral immunotherapy. So you consume the food. But there's additional approaches which are now available, which are being developed. So epicutaneous is exposure to that allergen through the skin, through a skin patch. And another approach is called sublingual immunotherapy, which is basically under the tongue. It's all different ways of actually introducing individuals to particular allergens. And so the whole idea is that it's a desensitizing process. So for anybody who's had seasonal allergies and you get small injections of, for instance, things that are environmental allergens that you react to, it's kind of the same process. And so it's basically you expose to increase larger and larger quantities of these to a point that you can actually now tolerate, that level that's actually there. So that's what oral immunotherapy is in this particular instance. But again, there's various versions of it which exist. Now, in terms of limitations, then there can be circumstances in which people cannot undergo it. Because if it's oral immunotherapy, if you think about it, you're actually consuming the thing that you're reactive to. And so depending on how it's done, some individuals can experience adverse events during the entire process of so-called updosing. So they might tolerate low levels, but as they start to go incrementally higher, they can't tolerate it. And so they can't get to the next level. And so they basically are not individuals who can qualify and complete the complete course. And typically what you want to do is to do this stepwise process over a course of many, many weeks. It might take 52 weeks in total to actually get to what they call the maintenance dose, which is the target dose that you want to get to, where you would have or realize the full benefit of desensitization. But if you can't basically tolerate that stepwise process, then you're not going to be able to complete the course of treatment. So it's not for everybody. And so for individuals who might be extremely sensitive to particular types of allergens, it may not work in that case. And so other ways of actually being introduced to the allergen through other routes, maybe sublingual, subcutaneous, might be another way of doing it so that they can complete a course of desensitization and receive the benefits. So oral immunotherapy exists. But the other thing that we need to be aware of is right now is in an ideal world, you would want to deal with the totality of food allergies that an individual has. And typically when we do oral immunotherapy, we do it allergen by allergen. So right now, we often do that just for peanut. It doesn't basically address the other food allergies that somebody may have. It's specific for peanut. So that's another limitation, which is ideally, in the future, we'd want to be in a situation where if somebody had multiple food allergies, then there would be a combinatorial approach in which you would be exposed to multiple allergens all at the same time and tune off all of those reactions simultaneously so that you receive the full benefit. So that's where the field needs to go.
Thanks, Bruce. Going back to that maintenance dose, does that mean that if OIT does work in a successful case, is that a permanent fix, or does someone have to continue to eat, that allergenic food going forward?
It is a really good question, and we simply don't know the answer. What we do know is that when some people reach that maintenance dose and it's been tested and you stop exposure to the allergen, then within a matter of months, the allergy comes right back at you. And so that's been seen most often with peanut. And so there's only a fraction of individuals who actually get long-term, what we call durable desensitization after immunotherapy if you stop the exposure to peanut. So the safest course of action right now is to continue with exposure to peanut. So once you get to that maintenance dose, is just include it in your diet on an ongoing basis. If you do that, of course, you're not really testing the hypothesis, because the way you'll know whether you're really and truly cured is stop consuming the peanut on a regular basis and see whether a month later, several months later, you're truly tolerant. Because in our lives, if you are basically a healthy individual, you could afford to stop eating peanut for quite a while and then come back to it and you have no issue as well. That's the problem in this instance, is that you may be desensitized, but if you don't have that continuous stimulation to turn off that immune reaction, and then you come back to it at months down the road, you could still get an allergic response. So right now, we just don't know why is it that some people experience sustained unresponsiveness and other people do much better. under these circumstances. So right now, I mean, the current thinking is that once you've got to that maintenance dose and you've reaped the benefits, why not maintain it? Just keep going.
Thanks, Bruce. That makes more sense. It sounds like there's still a lot of research to be done. It sounds like we also need to continue to collect more data. I think our audience would love to hear a little bit more about the FAIR Patient Registry and why they should join.
Absolutely. So I think the whole point behind the FAIR Patient Registry, it was a way for basically documenting information from the patient perspective. So what do patients feel? What has been their experiences? What have they had, or what treatments have they sought? And it basically gives us understanding of their journey and the burden of disease, not only for themselves, but for their families, which is an important consideration. But now actually we're in a situation where we can build on that data set. So that's certainly one perspective, which is the patient perspective. We're in a position now, because we're expanding the scope of what we're doing, to incorporate other information, which is the physician's perspective, and that would be the electronic medical records. So now you'd be in a position to know the patient is feeling this, and the physician who's treating that patient is seeing this, and you can correlate these two observations. So that gets back to the point that I said earlier. Is somebody truly allergic to a particular food? Well, if they've been tested and it was confirmed in a diagnostic test that they're allergic, then yes, it's there. But not everybody undergoes those kinds of tests. And so they may feel as if they're allergic, but they've never actually been formally tested. And what happens is then they tend to avoid that food unnecessarily, and they might be able to consume it without too much difficulty. So this is actually, I think, an important point in time in terms of building out this data set, because the FAIR registry is unique in that regard, is that it's the largest registry of its sort, which can be used to help us understand what the patients experience. But also, we're now looking at ways in which we can take the opportunity of connecting patients to future clinical studies. So as you've described, I mean, there are new therapies that are on the horizon. And the question is, which therapy is right for which patient? By having the information that's present within the patient registry, we can basically identify whether individuals are candidates for future studies and contact them and invite them to participate in future studies. So this is a whole new dimension to actually using the registry, so that we're linking up patients to future studies based on the fact that they are eligible, they qualify. So studies right now are often looking for individuals with particular food allergies and particular age range. And so if that information is already in, if an individual's typed in their information into the registry and said, this is who I am and this is what I've experienced, then we're in a position, FAIR is, to then contact the individual, and we can serve as basically a go-between to say, we're aware of an upcoming clinical study. This might be actually something of interest to you. So I think this is really an important aspect related to this. So what I would suggest for everybody who's participating on today's meeting is visit our website. So it's foodallergy.org/registry, and check it in, find the information, because essentially, I think this is something that's going to grow, and it's something that could benefit research in general, but also give us an opportunity for us at FAIR to engage with individuals and understand your experiences.
Thank you, Bruce. It sounds like the FAIR Patient Registry is a great resource, both for future research as well as for the patient themselves. And I wanted to thank you and for all of the information that you were able to provide today. And also thank you so much to our audience here. Don't forget to visit foodallergy.org for a list of other great events, and please donate today. Thanks, everyone. Thank you, Dr. Roberts.
Thank you so much, Satya. Take care.
Take care.